Either ways, ectopic pregnancy is a life-threatening condition that must be taken seriously. What's up, beautiful people? Welcome to another exciting episode of TTC Diaries with Dr. O. You already know. Yeah, and today we're discussing ectopic pregnancy. Yeah, not a very exciting topic, but it's something that is very, very important. We need to discuss it, especially for women that are trying to conceive. If you happen to have an ectopic pregnancy, you need to be able to know what to do and things that could possibly cause it. So if you can prevent it, then you should be working at preventing this. And it's not just important for women who are trying to conceive, it's actually an important topic for everyone. So let's jump right into it. So some people might be wondering, what exactly is an ectopic pregnancy? Okay, so ectopic pregnancy is any pregnancy that implants outside of the womb. Yes, it's actually possible for you to be pregnant and the embryo is not in the womb but elsewhere. So where can the embryo be? Well, sometimes it can be in the fallopian tube, which is the most common place where ectopic pregnancies happen. Other times it can be anywhere else in the abdomen or even in the cervix. Either ways, ectopic pregnancy is a life-threatening condition that must be taken seriously. This is because it can cause, first of all, the pregnancy is happening where it's not supposed to happen. Pregnancy is supposed to be in the womb. Okay, anywhere outside the womb is a danger to you. And then just imagine it's in the tube. The tube is so tiny. At the time you get pregnant, the egg is tiny. But remember that this egg is going to develop into a full-blown baby. And imagine the baby developing in the tube. Of course, the tube is not going to be able to accommodate the baby. So what happens is, as the pregnancy begins to get larger with time, the tube is eventually going to burst, something that we call rupture. And this can be dangerous because it will cause life-threatening bleeding, right? That can lead to death in a matter of hours. So you really don't want this to happen. That is why, if you have an ectopic pregnancy, then the pregnancy must be taken out immediately. So first of all, how will you know if you have an ectopic pregnancy, right? Thing is, most ectopic pregnancies, at least in the early stages, you might not even have any symptoms. It's usually detected on a scan. And first of all, the first sign is pregnancy. So when you have a positive pregnancy test, when you miss your period, then you are pregnant. Now, if you are pregnant, the next thing you want to find out is the pregnancy in the womb or not? If it's in the womb, we're good. But if the pregnancy is not in the womb, then there's a problem, because it means that you have an ectopic pregnancy. The next question will be, where is it? So of course, the best way to find it is via ultrasound scan, pelvic ultrasound scan. How would you know if you have an ectopic pregnancy? Sometimes one of the symptoms that people have is severe abdominal pain, probably on the side of the abdomen where the tube located, you know, with the ectopic pregnancies, or probably on the side of the abdomen where the ectopic pregnancy is, or side of the ovary where it is, because ectopic pregnancy can also happen in the ovaries, right? So you can have severe abdominal pain. That can be a sign. Sometimes you might have light vaginal bleeding, especially if it implants around the cervix area. You might have light vaginal bleeding. But outside of this, there is not many symptoms that you have for ectopic pregnancy, except when it gets really bad, like maybe, you know, you start bleeding and then you start feeling lightheaded, dizzy and all that, which by then is already in the advanced stages and is a real emergency. Okay, so it's important that when you get pregnant, you do a pregnancy test and you see that you're pregnant. Make sure you do a scan, right, to check that the baby is in the womb. Very important. What are the things that can put you at risk of an ectopic pregnancy? Like, does it just happen to anyone, or are there people that are at particular risk of this? Okay, so yeah, an ectopic pregnancy can happen to anyone, but there are people that are at higher risk. Okay, so of course, smoking increases your risk of having an ectopic pregnancy. If you've had any ectopic pregnancy in the past, you are at risk of having another one, unfortunately. Then, if you are using an IUD, yes, intrauterine contraceptive device or intrauterine device, of course, the job is to prevent pregnancy. But if for any reason it fails, more often than not, the pregnancy is usually ectopic, right? So this is one of the downsides of using an IUD if it fails. So that's another risk thing that can put you at risk. Another one is sexually transmitted infections. If you've ever had any sexually transmitted infections, especially pelvic inflammatory disease that affected the tubes, right, that could cause tubal blockage and all that. It could lead to an ectopic pregnancy. Or if you've ever had surgery to your fallopian tubes or around the area of your fallopian tube, somewhere in the abdomen, and there are things that we call adhesions that could lead to tubal blockage, that could also put you at risk of ectopic pregnancy, right? So how is ectopic pregnancy treated, right? So for most part of it, anytime there's an ectopic pregnancy, because it's a life-threatening condition, what is usually done is surgery, either laparoscopic or open abdominal surgery, to take out the pregnancy. So they cut the tubes, to resect the tubes to take out the pregnancy. I don't know if it's in the tube or if it's in the abdomen, they just need to remove it, right? Because it's going to put you at risk. However, if it's still in the early stages, then they might use a drug, right, called methotrexate, that will help to stop the growth of the pregnancy and eventually get rid of the pregnancy as a miscarriage, depending on where the location of the pregnancy is. Okay, so of course you can't do this yourself. Never ever try to do anything yourself at home. Once you suspect you have an ectopic pregnancy or you've been diagnosed with an ectopic pregnancy, just make sure you see a doctor immediately. Go to the hospital immediately, because it is life-threatening. It can lead to death. Don't joke with it. But if you had an ectopic pregnancy, don't be sad, don't be devastated, okay, because you can always get pregnant again. And yes, you have more higher chances of getting another ectopic pregnancy, but the truth is you also have a good chance of getting a normal pregnancy, where your pregnancy is going to be in the womb. So don't be devastated, okay? This should not discourage you. Just keep trying. Remember what I always say, you are not alone on this journey to motherhood. Just keep your eyes on the prize and your baby will be here sooner than you think. Don't forget to like this video and share and subscribe with anyone you think might need to see this. See you next week.